Hi everybody, I am Naufal. Welcome to my channel. Today we are going to discuss regarding ABG analysis, that is arterial blood gas analysis. So here we are collecting the blood from the artery, not from the vein. Most of the students are thinking that it is very difficult to identify the condition of the patient by checking the ABG result. But by watching this video, you will get a clear-cut picture regarding the result of the patient according to the different values of the ABG. Within few seconds, you can identify the condition of the patient. So, watch the video till the end. Without any further discussion, we can move to the video ABG analysis. So, here we are collecting the blood from the artery, right? So, mainly three things you should know regarding ABG. Three normal values you should know regarding ABG, that is pH, PCO2 and HCO3. pH of arterial blood, PCO2 that is partial pressure of carbon dioxide, partial pressure of carbon dioxide, and HCO3 that is bicarbonate. Okay, so pH. Whenever you are checking the ABG, first you have to check the pH. The normal value is 7.35 to 7.45. This you have to keep it in mind. 7.35 to 7.45 is the normal pH in ABG. Regarding PCO2, that is partial pressure of carbon dioxide, that is 35 to 45 mmHg. So here I told 7.35 to 7.45. Here it is 35 and 45. Here also 35 is there, 45 is there. So you have to keep it in mind. This 7 went to heaven. Here in PCO2, that is 35 to 45. Here 35 is there, 45 is there. Here it is 35, 45. Very easy. And here HCO3, that is bicarbonate, that is 22 to 26 milli equivalent per liter, that is bicarbonate is the normal value is 22 to 26. So if you know the three normal values, keep it in mind, if you know the three normal values, you can identify four conditions mainly, that is respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. Okay, so four conditions you can identify with three things. So here you have seen that acidosis, alkalosis, again acidosis, alkalosis. To check it is acidosis or alkalosis, only you should know regarding pH. If you know the pH, the normal range is 7.35 to 7.45. If the pH is less than 7.35, if the pH is less than 7.35, it is acidosis. For example, pH of the patient is 7.30, that is less than 7.35. The patient is in a condition of acidosis. So easily you can identify which is acidosis, as well as if the value is more than 7.45, the pH is more than 7.45, that is alkalosis. To identify acidosis or alkalosis, you should know only regarding pH. The pH normal, it is 7.35 to 7.45. If it is less than the normal, that is less than the 7.35, you can call it as acidosis. If it is more than 7.45, you can call it as alkalosis. To identify this acidosis, alkalosis, acidosis, alkalosis, only check the pH. In the beginning, I told first in the result, if you are getting a ABG result, you have to check first pH. So you will get whether it is acidosis or alkalosis. Clear? So first you have to check pH, keep it in mind, primary, that is the first or primary. P you have to keep it in mind, primary or first you have to check pH. Next one is PCO2, that is the partial pressure of arterial blood. PCO2, partial pressure of carbon dioxide. Okay, partial pressure of carbon dioxide in the arterial blood. Partial pressure of carbon dioxide. Okay, so here it is 2. I told first you have to check primary first. Here you can see 2. So second step you have to check PCO2, and here you can see 3. That is the third step. First step you have to check pH, then you have to check PCO2, then you have to check HCO3. Clear? So here you can identify regarding the acidosis and alkalosis by checking only pH. Clear? Now regarding the respiratory acidosis, or it is a respiratory alkalosis, how you can identify? So the indicator of respiratory case is PCO2, that is partial pressure of carbon dioxide. PCO2 is the indicator of respiratory cases. So if you know regarding pH and PCO2, you can identify whether it is a respiratory case. Okay, with example I will teach you. So here pH of a patient is 7.30 and PCO2 is 48 and HCO3 is 24. Okay, so the first step what you have to do, you have to check the pH. The normal range is 7.35 to 7.45. So it is less than 7.35. By looking the pH itself, you will get an idea it is acidosis. The pH is less than 7.35. It is a acidosis case, right? So acidosis. Clear? Now PCO2, the normal range is 35 to 45, right? So it is increased. Okay, this arrow you have to keep it in mind. This arrow you have to keep it in mind. Here pH is decreased and PCO2 is increased, and HCO3 normal range is 22 to 26. So the HCO3 is 24, that means that is in a normal range. So 3 arrow you can see, pH is decreased, PCO2 is increased and HCO3 is normal. So by looking the pH you got it is acidosis, and here PCO2 is increased. So this is respiratory acidosis. Got it? That is a respiratory case because the PCO2 is increased and pH is decreased. Always you have to keep it in mind regarding this arrow. In a respiratory case, if it is a respiratory case, always the arrow, the pH and the PCO2 will go in opposite direction only. If the pH is decreasing, if it is a respiratory case, definitely it will, the PCO2 will increase. If the pH is increased, if it is a respiratory case, definitely the PCO2 case will decrease. It will never go in same direction. It will go in opposite direction. Keep it in mind, they are not friends, they are enemies. Always if it is a respiratory case, this arrow, so first you have to keep it in mind regarding the arrow, this one is decrease and this one is increase. So it is going in opposite direction, right? pH is decreased and PCO2 is increase. And here HCO3 is normal. So this is a metabolic indicator. Metabolic indicator is normal and the respiratory indicator is PCO2. It is increased. Okay, so here less than 7.30, we can identify that it is a acidosis case. Which acidosis? The partial pressure of carbon dioxide is increased. Okay, so the arrow you have to keep it in mind, not with the value, with the arrow you have to keep it in mind. With another example, you will get the idea. Next one. pH of the patient is 7.47 and PCO2, partial pressure of carbon dioxide, is 32. Again use the arrow. pH is increased, right? So pH is increasing means it is alkalosis. Clear? Now PCO2 is decreased. The normal value is 35 to 45. Here it is decreased. So the arrow is going in opposite direction. One upward direction and another one is going downward direction. You can confirm it as respiratory case because PCO2, respiratory indicator, is partial pressure of carbon dioxide. This is a respiratory case. Still you have to check the HCO3 also. So here it is normal. HCO3 is normal. Clear? Now here also I told it is opposite direction. pH increased. If it is a respiratory case, definitely PCO2 will decrease. So they are going in different direction. If you are seeing, for example, if you are seeing pH 7.47 and PCO2 48 and HCO3 34. Okay. So first what you have to do? Keep it in mind regarding the arrows. pH is 7.47. That means pH is increased than the normal level. It is a alkalosis case. Right, alkalosis case. Now PCO2 is also increased. So most of the students, what they will do, PCO2 is increased, so it will be a respiratory case. That is wrong. In the beginning I told, if it is a respiratory case, even though it is abnormal, it will go in opposite direction. If it is a respiratory case, definitely PCO2 will decrease only. Okay, so this is not a respiratory case. Now move to the third step. First, second, third step, that is HCO3. Here the normal HCO3 is 22 to 26 and here it is 34. Right. So here HCO3 also increased. Okay. But one thing you have to keep it in mind, metabolic bicarbonate is the friend of pH. They are good friends. They will go in same direction only. So it is a metabolic case. It is a metabolic case, not a respiratory case. All the values are abnormal. pH is abnormal, PCO2 is abnormal, HCO3 is also abnormal. But you have to keep it in mind regarding the arrow. If it is a metabolic case, pH will go in the same direction. Together they will go. pH is increasing, HCO3 also will increase. If it is a metabolic case. If it is a respiratory case, pH is increasing, the PCO2 will decrease. If the pH is decreasing, PCO2 will increase in opposite direction. So you have to keep it in mind, a mnemonic, that is ROM. Okay, you have to keep it in mind, a mnemonic, that is ROM. ROME, that is respiratory opposite metabolic equal. Respiratory opposite, always if it is a respiratory case, the pH will be opposite to the PCO2, that is RO, respiratory opposite. But ME, that is metabolic equal. If it is a metabolic case, it will go equally in same direction, together they will go. pH is increasing, HCO3 will increase. pH is decreasing, HCO3 will decrease. You will never see them in opposite direction, and you will never see PCO2 and pH in same direction. Don't think it is a respiratory case. So arrow is very important. Whenever you are seeing a result of the patient, check the pH, put the arrow, check the PCO2, put the arrow, check the HCO3, put the arrow. Keep it in mind regarding ROM. pH is increased, you have to check whether the PCO2 is decreased. If it is not decreased, it is not a respiratory case. And HCO3, together they will go. Definitely HCO3 will increase. So together who is going? Metabolic case. So here it is a metabolic alkalosis. Clear? Next example. pH of a patient is 7.30, PCO2 is 3, 2 and HCO3 is 20. Okay. So here also start with the arrow, give the arrows. Check the normal value, give the arrow. pH is 7.30, that is pH is decreased. That means it is a acidosis case. Looking at the pH itself, you got it is acidosis. pH is 7.30, arrow is decreased, downward arrow. PCO2 also decreased, but same direction it is going, they are not going opposite direction. So it is not a respiratory case, it is confirmed. Now HCO3, that is bicarbonate, that is 20, normal value is 22 to 26. So it is decreased. Same direction they are going. Keep it in mind regarding ROM. Respiratory it will be opposite, but in metabolic case it is equal. HCO3 bicarbonate is the indicator of metabolic. So here it is metabolic acidosis. Clear? Now you got an idea regarding respiratory acidosis, respiratory alkalosis, metabolic acidosis and metabolic alkalosis. Clear? So always keep it in mind, whenever the pH is decreasing, it is acidosis. And respiratory case, if it is pH and PCO2, that is partial pressure of carbon dioxide, will go in opposite direction. If it is a metabolic case, pH and HCO3, that is bicarbonate, will go in same direction only. These are the 4 conditions mainly you can see in ABG analysis result, the condition of the patient. But this much knowledge is compulsory for you for the competitive exam. Sometimes they will ask regarding compensation also. So regarding this topic, sometimes they will ask regarding the compensation. 3 type of compensation is also there. That is very easy. With the same example only, you have to identify the compensation. Okay. So with example, I will teach you, don't worry. Okay. We can see regarding the compensation. So this much is clear. Now regarding the compensation, with example, pH of the patient is 7.2, 8. This is the pH. Next, PCO2 of the patient is 48 and bicarbonate HCO3 is 25. Okay. So here again you have to check normal pH 7.35 to 7.45. Here it is decrease. The arrow we have to give decrease. So it is a acidosis case confirmed. Now regarding the respiratory indicator PCO2, partial pressure of carbon dioxide is increased than normal. Normal it is 35 to 45. So in opposite direction, respiratory increased and pH is decreased. And here HCO3 is normal. The normal it is 22 to 26. Here it is 25. So it is a normal arrow. So it is a respiratory case. Right? So here pH is abnormal and PCO2 is abnormal and HCO3 is normal. And this is a respiratory acidosis case. This much you know. To check the compensation, whether it is compensated. So three types of compensation we can see. Compensation, okay, three types of compensation you can see, that is uncompensated, partially compensated, fully or compensated. Three type you can see: uncompensated, partially compensated, compensated or fully compensated. Three type you can see. So here pH is abnormal, right? pH is abnormal, confirm. PCO2 is abnormal but HCO3 is normal. If you are seeing any case like this, if you are seeing any report like this, that is pH is abnormal among PCO2 and HCO3. PCO2 and HCO3, one will be abnormal and one will be normal. One will be abnormal and one will be normal. It will occur like this also. HCO3 will be decreased and PCO2 will be normal. Anyone among PCO2, one is normal and one is abnormal. Okay. pH always it will be abnormal and here it is abnormal and here it is normal. If you are seeing pH is abnormal among PCO2 and HCO3, anyone is abnormal and anyone is normal. If you are seeing, that is uncompensated. Okay, uncompensated respiratory acidosis. The case you have identified, right? The case you have identified, it is respiratory acidosis. If you are seeing anyone in this PCO2 or HCO3, one is normal. Okay, not with the pH. pH will be always abnormal. And HCO3 or PCO2, anyone will be normal and anyone will be abnormal. You can call it as uncompensated. Now add this respiratory acidosis or respiratory acidosis uncompensated. Sometimes in the exam the option will be respiratory acidosis will not be there. Like this they will give to confuse you. So respiratory acidosis uncompensated, one will be normal among PCO2 and HCO3, not with the pH. pH will be always abnormal. Among this, one will be normal and one will be abnormal. Either HCO3 or PCO2 will be normal and will be abnormal. So you can call it as uncompensated. Compensation has not occurred. HCO3 has not tried to compensate this problem, that is pH is abnormal. You have to keep it in mind, one will be normal, one will be abnormal, that is uncompensated. And the same thing you have to identify respiratory acidosis. First you have to go with the arrows, check the arrow, check the condition and check the values. Any abnormality and any normal values are there in PCO2 and HCO3, you can call it as uncompensated respiratory acidosis. Uncompensated, one will be normal among PCO2 and HCO3. Clear? Now we can see regarding the partially compensated. Okay. Partially compensated. So here pH of the patient is 7.34. Then PCO2 is 49 and HCO3 is 29. Okay. So first what you have to do? You have to give the arrows. So pH is less than 7.35. So it is downward arrow, confirm it is acidosis. Clear? Now PCO2 is also increased. The normal range is 35 to 45, but it is increased. And HCO3, it is also 22 to 26 is the normal, 29 it is also increased. So look at the arrow, this is going downward. If it is a metabolic case, HCO3 also should go downward, but it is going up, and PCO2 is going in opposite direction of the pH. So we can confirm it as respiratory. This much is clear, right? Respiratory acidosis. Now regarding the compensation, you know regarding uncompensated, right? Now here you check pH is abnormal, PCO2 is abnormal, HCO3 is abnormal, everything is abnormal. Only the thing you have to keep it in mind, pH will be always near normal. That is 7.35 is the normal starting range. Here it is 7.34. pH will be near normal, but it is abnormal. You can call it as partially compensated. Partially compensated. Okay. So respiratory acidosis partially compensated. Sometimes for your exam the option will be, they will give the normal value like this, and respiratory acidosis partially compensated. So don't get confused. All the values are abnormal, just check it. And pH will be near normal. Sometimes it will be 7.34 or sometimes it will be 7.46. Near normal, near to acidic or near to alkalosis. In that range it will be. Just near it is, but it is abnormal. So all the values are abnormal. If you are seeing, that is a partially compensated, and all these things are same. Respiratory acidosis, go with the arrow, start with the arrow, check the pH, check the PCO2, check the HCO3. Okay. Now last one is compensated or fully compensated. Okay, so here the pH is 7.38 and the PCO2 is 55 and the HCO3 is 30. Okay, with the arrow we can give pH 7.38, that is pH is decreased. Sorry, pH is normal. Okay, pH is normal, and PCO2 55, that is increased, and HCO3 30, normal it is 22 to 26, but it is increased. Now what you will do? pH is normal, PCO2 is increased, HCO3 is also increased, but pH is normal. What you will do? An idea you have to use here. If you are seeing a report like this. PCO2 is increased, HCO3 is increased, or PCO2 is decreased or HCO3 is decreased. If you are seeing like that, the idea what you have to do, here pH is normal, always keep it in mind, pH is normal. So the idea you have to do, we know the normal range of the pH is 7.35 to 7.45, right? So here the exact midpoint or the mid value is 7.40. Listen carefully. The normal range of pH is 7.35 to 7.45 and the mid value or the midpoint is 7.40. So here the pH is normal. So the idea or the principle you have to use is the value that is coming less than 7.40. The value that is coming less than 7.40, that is 7.39, 7.38, 7.37, 7.36 and 7.35. Consider it as acidic, that is acidosis. Okay, less than 7.40. Don't include 7.40, that is neutral. 7.40 is considered as neutral and the value that is coming more than 7.41 to 7.45, that is 7.41, 7.42, 7.43, 7.44 and 7.45. In that range, consider it as alkalosis. So we are considering it is moving to alkalosis side and here it is less than 7.40, that is from 7.35 to 7.39. We are consider it as it is moving towards acidosis side. Clear? Only in this case you have to use this idea. If the pH is normal and both the value you are getting abnormal, what you will do, you have to use this idea. The midpoint is 7.40, it is neutral. 7.35 to 7.39, that is acidosis. 7.41 to 7.45, that is alkalosis. Clear? So here in our example it is normal we have given, but as per this principle it is 7.38. So up to 7.39 we can consider as acidosis, that is decreased, right? It is decreased because it is 7.38 till 7.35 to 39 we can consider as the pH is decreased. So it is a acidosis case. Okay. Now here respiratory case is increased, PCO2 is increased and HCO3 is increased. So in opposite direction it is pH and PCO2. So it is a respiratory and here it is 7.38. In this case we are considering it as acidosis. Okay, and regarding the compensation, that is compensated, or sometimes you can see in the question paper fully compensated. Both are same. So pH is normal, PCO2 and HCO3 is abnormal, that is fully compensated. What happened here? Both of them help, PCO2 and HCO3 help to maintain the normal pH and pH is moved to normal level. But to get the result we are using a technique, that is till 7.35 to 7.39, that is in the acidosis side, and from 7.41 to 7.45 it is alkalosis side. Okay, one more example I will give you. If it is in the same case, pH is 7.43, PCO2 is 47 and HCO3 is 38. So here as per the pH normal value, it is normal, but as per our technique, if in this case PCO2 is increased or HCO3 is increased, what we have to do? Use that mid value 7.40 as normal, and above 7.41 consider it as alkalosis, 7.41 to 45. So the pH is, we can consider here it is increased, that is alkalosis side it is. Here respiratory PCO2 also increase, same direction, so it is not a respiratory case, and HCO3 is also increased, so in same direction they are going. So here it is a metabolic alkalosis, but keep it in mind, it is a compensated or fully compensated. Fully compensated, because pH is normal, both the PCO2 and HCO3 are abnormal, that is called compensated metabolic alkalosis or metabolic alkalosis compensated. Clear? Sometimes you can see fully compensated, both are same. So 3 compensation are there, 3 normal value are there, and 4 abnormal conditions are there. pH you have to keep it in mind, PCO2 you have to keep it in mind, HCO3 you have to keep it in mind. 3 value regarding the condition: respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. 4 condition. And regarding the compensation: uncompensated, partially compensated, compensated or fully compensated. If the pH is abnormal and HCO3 and PCO2, among these one is normal and one is abnormal, that is uncompensated. If the pH is abnormal but it is near normal, and the PCO2 and HCO3 it is abnormal, that is partially compensated. And keep it in mind, pH is normal and PCO2 and HCO3 is abnormal, that is compensated or fully compensated case, pH will be normal. But you have to use the technique. Midpoint is 7.40. From 7.35 to 7.39 the pH is considered as acidosis side decreased, and from 7.41 to 45 it is considered as alkalosis side, that is increased. The exact midpoint is 7.40, that is neutral. Clear? That's all regarding ABG analysis. I will give you one question and you have to give the answer in the comment box. Okay. So the question is, pH is 7.28 and PCO2 is 47 and HCO3 is 23. So the options are: option A, metabolic alkalosis, okay. Option B, respiratory acidosis, option C, metabolic acidosis, and option D, option D, respiratory alkalosis. Okay, these are the option. This is the question. pH value of a patient is 7.28, partial pressure of carbon dioxide is 47 and the bicarbonate HCO3 is 23. So just comment the answer. We will meet soon with